Well, thank you very, very much, Paddy, for the really lovely introduction and the kind introduction. It's a privilege and a pleasure to join everybody today. And I was telling you that this morning I managed to find a 2-hour window to go cycling in the backcountry lanes in the Peak District. And while I was out, I was thinking about what we need as societies, communities, is much more game-changing, so that all of us are able to live happier, more fulfilling lives, more love-filled lives with a sense of delight and wonder in our worlds. So it is a real privilege today to be able to join this conference, particularly with the focus on positive behavioral support and how we create conditions and circumstances and opportunities and potential for everybody, all humanity. We've been through, I think for me, the starting point of my comments, which I hope will be useful for people, is to acknowledge where we are and what we've been through the last 2 years. Somebody described this last 2 years recently as a global shiver. And that global shiver has been tragic in its consequences and has created an enormous amount of fear, of separation, of dislocation, of disconnection between people. And when we go through really difficult times, as human beings, we know it's also an opportunity for enormous learning and for growth as well. So out of this tragedy and this fear and this difficulty, there has been a huge amount of learning. I've just been reading as well about the impact of the vaccination program. The King's Fund has produced a study showing how almost the walls came down from organizations in healthcare, in social care, in local authorities, voluntary groups, community volunteers, the general public. And there was a learning about how we could all work together to create better conditions for people to live their lives in fulfilling and happy ways. But I think the most important lesson of the last 2 years is the lesson of compassion. The enormous compassion that frontline staff, particularly in healthcare, have shown, and social care have shown for patients, service users. You know, many of them were coming into work every day in fear of their lives when they didn't have adequate personal protective equipment. And still people went into work and provided care for COVID patients. Staff in organizations all over the country were supportive and compassionate to each other. You know, what we learned from the first survey in the National Health Service to be conducted since the pandemic, that was back in 2020, was that the main factor that enabled people in healthcare to cope was the support of their colleagues and the teams that they worked in. And also, I think that what we saw was a huge upwelling of compassion in the community. The people, against all of the odds and against all expectations, did stay at home. They did protect the NHS and they did save lives. And it's really easy to kind of somehow minimize what that was about, but people didn't go out. They didn't go and spend time with their loved ones. They didn't go and hug their elderly relatives. They didn't spend birthdays and Christmas together. There were huge, it was a huge response. And I've been really impressed the last year reading Rebecca Solnit's magisterial book, A Paradise Built in Hell. It was actually published in around 2010, but it's a study of disasters around the world and how what we see typically is that political elites believe that people won't cooperate. They'll be selfish, they'll riot, they'll loot in a disaster. But actually, typically what her book shows is what we see is a huge upwelling of compassion and care. And that's certainly what we saw right across the United Kingdom. Hundreds of thousands of people volunteering formally to help, but also informal help for neighbours, elderly people living alone. And so I think that a really important lesson for us going forward is the lesson of compassion. And I think what we have to do is think in terms of how we transform our teams and organizations so they're able to fulfill their purpose in society. I mean, ultimately, our purpose is surely helping everyone to live fulfilling, happy, safe, love-filled lives. And we're not doing that at the minute, and our organizations are not doing that. And the data on levels of engagement and satisfaction at work of people across Europe it's deeply depressing reading of how so few people feel engaged in the workplace most or all of the time. We're talking about 17% of people, and the rest deeply alienated somehow from their work. So I think we must think in terms of how we transform teams and organizations for the future. And compassion, I think, has to be at the core of that. So what does it mean, this rather shimmery word? I think if I'm to be compassionate to somebody in pain or fear or distress, then I have to do 4 things. I have to attend, understand, empathize, and help. And attending means, it has, I think, 2 meanings. It means being present with the other, being present with the other, giving my attention. Nancy Klein has a wonderful way of describing that. She calls it listening with fascination. And second, I have to seek to understand the other's pain, distress, fear, situation, not by simply imposing an understanding from some, apparently superior knowledge position, but through a dialogue, achieving a shared understanding. And third, I have to have an empathic feeling response, feeling the other's pain, fear, distress, without being overwhelmed by it, without making it my drama. And that gives me the motivation for the 4th element of compassion then, critical element, which is helping or serving the other person in some way, even if it's simply by helping the other to articulate what they're experiencing, what the difficulties are, or helping in more practical, instrumental ways. And we know from neuroscience studies using functional magnetic resonance imaging, which looks at very small movements of blood around the brain, that there's a really significant difference between empathy alone and compassion with that additional helping component. So when people are asked to be empathic towards somebody in pain or distress, that's associated with the activation of various pain centers in their brains. Whereas when we ask them to be compassionate with an additional helping component, that's associated with the activation of reward centers in the brain. And that makes sense because we know that the vast majority of us, 99% of us, have been hardwired by evolution to be compassionate, to be altruistic, to help others. And, it made sense in evolutionary terms because compassion, helping others, enabled us to form groups that felt a strong sense of belonging and connection, where we could raise our young together, where we could share resources, where we could protect ourselves from threat. And compassion is about blurring the boundaries between self and other, increasing that sense of belonging. And I think connection is fundamental to who we are, to what we are as human beings, as aware, sentient, conscious beings. Belonging is profoundly important in human behavior. We're as likely to die from the effects of loneliness as we are from the effects of, say, smoking or the effects of obesity. But we also know a lot more now about how important compassion is in health and social care from hundreds of studies that have been conducted internationally. And I want to just share a sample of those with you to give you a sense of the role of compassion in health and social care. These are predominantly based on randomized controlled trials, the sort of gold standard of research in medicine. Or they are meta-analyses where the data from all of the studies on a particular topic is combined to give us an overall picture of what the research is telling us. So the first is a couple of randomized controlled trials of anaesthetists visiting patients prior to surgery, where they either do a normal visit and provide sedatives, or they do a visit where they don't provide sedatives, but they're extra compassionate in their interactions. And we see that the latter intervention is associated with patients feeling calm, but not drowsy, whereas the reverse is true for the sedative visit. But also those patients who receive that compassionate visit from the anaesthetists have a much lower requirement for painkillers post-surgically and a significantly shorter length of hospital stays, actually hugely important given the difficulties we have with hospital beds in our country. And the second example is two randomized controlled trials in the US and Italy of patients with an early diagnosis of non-small cell lung cancer, which is likely to be terminal. And it was a study of quality of life where they were randomly assigned either to normal early cancer care or to normal early cancer care plus early palliative care. So if you like, kind of extra compassionate care. And the people in that group did indeed have a much better quality of life. But what was a completely unexpected finding was that they also lived significantly longer. And we see similar large effects of clinician compassion in the treatment of long-term disorders like HIV and diabetes, and of therapist compassion in the treatment of mental health problems. So one of the objections that people working in health and care often raise is, well, yeah, of course, but we don't have time. But in fact, what most of the research suggests is that more compassion doesn't necessarily affect encounter length. It's a bit depressing to see that in 17 out of 18 studies, compassion declines during medical training, for example. I'm working currently with colleagues in the northwest of England who have implemented a compassionate leadership training program for doctors in training across the northwest and the foundation school there, and also for those involved in their training. But also what's really important, and I think is consistent with what I was saying earlier about the neuroscience studies, is that when we ask, say, GPs or nurses to be extra compassionate in their interactions with patients over a 2-week period, that has a significant impact on their own mental health with lower levels of anxiety, stress, and depression. So what the research, I think, tells us is that compassion is the most important intervention there is in healthcare. And as you've seen, the effect sizes are truly remarkable, greater than the effects of aspirin, commonly used in the early treatment of heart attacks, and of statins in the 5-year risk of a cardiovascular event. So I think when we are considering how we transform our teams and organizations for the future, that the question for us is, how do we create the conditions where staff will treat patients, service users, clients compassionately? How do we create the conditions where they'll treat each other compassionately, that staff will treat each other compassionately? And how do we create the conditions where they'll be compassionate towards themselves? And the answer to that question is, well, that's, of course, the culture of our organizations. How do we affect culture? How do we shape culture? Well, every interaction by every one of us every day is an opportunity to shape the culture of our teams, our organizations, our communities. How warm we are, how irritable we are, how cynical we are, how compassionate we are, the emotional ripples spread out through a kind of, if you like, through a sort of emotional contagion. But we know from the last 100 years of research on culture in organization that the role of leaders, formal and informal leaders, is particularly powerful. My view is everybody working in health and care, everybody should see themselves as leaders, because we're all responsible for ensuring high quality, continually improving and compassionate care. But so the role of leaders, formal and informal, is particularly powerful in shaping culture, because what leaders pay attention to and what they're focused on and what they portray in their own behavior tells us what it is that's important to them. And we look to leaders for messages about what's important, what we value. And so it's vital that leaders embody compassion fundamentally in the way they lead. And in practice, what that means is leaders paying attention to those they lead, being present with them, listening with fascination to them, sensing problems, not seeking comfort. Leaders seeking to understand the challenges that those they lead face. And, the challenges for those working in caring professions were already enormous long before the pandemic struck. But since the pandemic, they've increased even more dramatically. And this is about leaders seeking to understand through having a dialogue rather than imposing some elevated hierarchical understanding from afar. And then leaders who have an empathic response to those they lead. A lot of my work is with colleagues in health services, and I hear harrowing stories of nurses on third 12-hour night shift not having had time to take a break or get food or even get water, and then being too tired to drive home and afraid of being involved in a road traffic accident. So it's leaders having the courage to empathize with those they lead, and then leaders helping those they lead. And in the context of leadership, helping is helping people to do their jobs more effectively by helping to remove the obstacles that get in the way and helping to ensure that they have the resources they need to do their jobs effectively. The right numbers of staff, making sure people have got the skills they need and the equipment that they need. And this is not some new model of leadership. We've known for 60 or 70 years that these 4 behaviors are critical to effective leadership. And it's no coincidence that the behaviors that constitute really effective leadership are the same behaviors that constitute compassion, because they're the behaviors that enable us to connect with one another. As I said, to blur the boundaries between self and other, to feel a sense of trust and belonging. And it's not, it's not only about this being the right way to lead individually, it's the right way to lead in organizations and teams too. So, for example, in the private sector, research over a number of decades now by people like Ben Schneider in the United States have shown what he calls the value chain, so of this kind of leadership. So if you take some of the work he's done in retail organizations, where staff in those organizations generally report their leaders behave in these 4 ways, that's associated with higher levels of staff satisfaction, staff engagement, customer service, customer satisfaction, customer loyalty, and at the end of the chain, company productivity and profitability. I had the privilege back in 2003 of leading and designing the first national staff survey for the NHS in England. And that it was the first time there was a single staff survey for the whole of the NHS. And it's been run 18 years, every year for 18 years since, including in 2020, as I mentioned. And around 500,000, well, more than 500,000 people respond to that survey. They complete that survey every year. So it's created the most amazing data set, huge data set over time that enables us to do the most sophisticated statistical longitudinal analysis. And what it shows is exactly the same value chain that I've just described. So when staff in NHS trusts generally report their leaders behave in these 4 ways, we see subsequently in those trusts higher levels of staff satisfaction and engagement that has an impact on patients being satisfied with the care they receive, on care quality as assessed by the Care Quality Commission. Where staff generally report their leaders don't behave in these 4 ways in trusts, then we see staff in those organizations subsequently reporting high levels of chronic excessive workload, high levels of stress. That in turn impacts upon patient experience. Patients report being treated with less compassion and respect and dignity. And it affects also care quality, financial performance, and is associated with significantly higher levels of avoidable patient mortality. So for all of these reasons, compassionate leadership, I think, is core to how we must lead our organizations and teams in the future. And it's important to emphasize this is absolutely not some soft cushion, sort of scented candles approach to leadership. On the contrary, I think it requires much more courage and authenticity than what can be, the rather easy opt-out of command and control. I'll just tell people what to do, and because I'm the boss, they must do it. It's a very different way of understanding leadership. It's because compassion is not something that is, in a sense, compartmentalized. I mean, I think to understand compassion, we have to understand it as a way of being. It's not something we choose to do. It's a way of being that we choose. As I've tried to explain, it's a very natural part of who we are. And in a sense, what gets in the way of us being naturally compassionate is our focus on achieving our goals and competing, and maybe our focus on managing the threats, the things that make us afraid. So it's about how we develop that way of being as leaders. And so that implies a really strong focus on being effective, ensuring our teams and organizations are effective for the people that we provide services for the people we support, for the people we care for the people we lead in our organizations, for our colleagues, and indeed for ourselves as human beings. So it implies a very strong focus on performance management. And so I think compassionate leadership is about being effective as a leader. And what that means in practice is ensuring we have clear direction in our teams, our organizations, an inspiring vision of what we're seeking to achieve, and a set of values and 4 or 5 associated goals, not as just a bunch of words on the website, but as a beacon that guides our decision-making and our discussions day by day, hour by hour, throughout our work lives. And it's also about ensuring alignment, that people in teams and between teams and across organizations are aligning their efforts in service of that core purpose. They're not being dissipated on petty conflicts and unnecessary bureaucracy, and that it's leadership that creates commitment, a sense of trust and motivation. And, one of the characteristics of the last 2 years has been a renewed focus on the obscenity of discrimination and racism in our society. And I think that if leadership is not inclusive, then by definition, it's not compassionate, because compassion and inclusion are like two sides of the same hand. They're both about belonging. You know, if a young child is excluded from her friendship group in the playground, we know it has an impact on inflammation of the central nervous system, which causes negative health consequences. We know also that people who are subjected to discrimination over the lifespan, people with disabilities, people from minority ethnic groups, people from lower socioeconomic groups, we know that there is a biological weathering effect of that discrimination, resulting in worse health outcomes, earlier mortality. And we saw during the pandemic the impact of the pandemic on those groups in society generally, tragically, as well as amongst health and care staff, the disproportionate impact on infection rates and tragically deaths amongst staff, for example, from minority ethnic groups or people in the general population with disabilities. So inclusion, compassion and inclusion are health issues. And of course, you know, they're performance issues. I've been studying team working in health and care since the 1980s, and all of our research, whether it's with primary healthcare teams, community mental health teams, executive teams, breast cancer care teams, tells us that diverse teams and indeed organizations are much more effective and much more innovative when they have positive cultures where diversity is valued. They're much more innovative and effective than more homogenous teams and organizations. Why? Because they have a greater diversity of knowledge and skills and experiences to draw on. And you know, diversity is the nature of our universe. It's the nature of our planet. It's the nature of biodiversity. It's the nature of humanity. And our challenge, I think, for the future is to recognize that all of that should be embraced and valued as the nature of our reality. And compassionate leadership is also not about, you know, wanting to be more liked as a leader, so I have more power. It's about helping everybody feel they have leadership responsibility, particularly in caring contexts, because as I said, quality improvement, high quality care, compassionate care are the responsibilities of all of us. And if quality of care is not improving, then it's going backwards. So for me, one of the great paradoxes, for example, of our National Health Service is that we have the largest, probably the most motivated and skilled workforce in the whole of industry, yet we largely manage these amazing people through command and control. The most effective organizations around the world, regardless of sector, usually have no more than 3 or 4 reporting levels. In the typical NHS trust, reporting levels are in double figures. And for every reporting level we add about 10% to bureaucracy. So it's absurd. It makes no sense. So part of our commitment, I think, to the future has to be how we create more collective structures, more team-based structures, rather than these extended hierarchies, which are so dysfunctional. And implicit in that is also how we work across boundaries with other teams, with other departments, with other organizations. I think the future of care in our society will be founded upon working together, as I was mentioning in relation to the vaccine program, working together, community groups, service user groups, healthcare organizations, local authority, voluntary organizations, working together collectively to determine how we can create the best conditions for people to lead fulfilling lives. And that will be based on a number of factors which I've listed in under the system leadership, but particularly on a commitment to always asking the question, how can our team or organization help you, help your organization, your team, so that together we deliver more effectively for the future? I mean, it has to be the way forward that we, for transforming the way we work together. So compassionate leadership is about transforming culture, and it is, I think, founded on presence, attention, listening with fascination, and caring. Now, I've mentioned a number of times the levels of stress that people working in health and care settings experience because of the huge demands on them. In the NHS, for example, we know that currently around 44% of staff report that they've been unwell as a result of work stress during the previous year. During the pandemic, we've seen much higher levels of post-traumatic stress disorder for some groups of staff, for example, those working in ICU and accident and emergency, than we see amongst troops returning from combat zones. We see high numbers of staff intending to quit and actually quitting. Even before the pandemic, 1 in 4 nurses were leaving the NHS within 3 years of joining. I mean, that's a stunning statistic and an indictment of the kind of work context that we're creating for dedicated, committed people. GP stress is at the highest it's been, even before the pandemic, it was at the highest it had been since the introduction of the GP Working Life Survey in 1998. So what are we to do about all of this stress at work? Well, I think it's beyond yoga. It's beyond mindfulness. And I'm not seeking to denigrate those kinds of interventions. I learned meditation. I learned what meditation was all about in my first year at university, many decades ago now. And meditation has been a really important part of my daily life ever since. But these sorts of interventions are not addressing the underlying causes of people's difficulties in the workplace. And I've had the privilege over the last 4 years, first of co-chairing an inquiry, an independent inquiry on behalf of the General Medical Council into the mental health and well-being of doctors across the UK. And then 2 years ago, leading an inquiry with my colleagues in the King's Fund on behalf of the Royal College of Nursing Foundation into the mental health and well-being of nurses and midwives across the UK. And what was clear from all of the research that we did, from the academic literature and from all of the conversations we have, that stress at work is a consequence of us failing to meet the core needs of people in the workplace. And to guide our inquiries and our recommendations, we drew upon a well-established model of core work needs. We called it the ABC of core work needs. All of us must have these 3 needs met at work for us to be well and intrinsically motivated. The need for a sense of control, that we're not just cogs in the system, we're not just resources to be moved around at will, that we have voice and influence, that we work in contexts of openness and justice and fairness, rather than what we saw in many instances for healthcare staff was that they felt that they were working in contexts of fear and blame, and that people have control over even basic biological factors at work that, you know, as a nurse or doctor or as a care worker, you have time to take a rest break when you need to, have a proper lunch break, to be able to go to the toilet when you need to, that you have influence over your work schedules, your rotas, so that you can better balance the demands of home and work life and your own caring responsibilities. And the second is the need for a sense of belonging. We need to feel valued and respected and cared for and loved, if you like, in our workplaces, in our teams. I mean, you know, work organizations are just another form of human community, and to feel that we belong is, as I've said already, is so important to our well-being. And it is interesting, I mentioned, you know, that during the first year of the pandemic, it was people's teams that supported them. It was the team working which was the most protective factor. Indeed, we found that in healthcare, people who work in teams where they report they have clear shared goals and they meet regularly are 50% less stressed than people who don't. And yet we see only 40% of the 1.3 million staff in the NHS report working in teams that have clear goals and that meet regularly. Yet, the more people who do work in such entities, such teams, in NHS trusts, the lower the levels of stress, as I've said, the higher the levels of patient satisfaction, better the care quality, the better the financial performance, and dramatically lower levels of avoidable patient mortality. So building back team working better for the future, I think, is key to how we develop our teams and organizations. You know, I mean, we've worked in teams for hundreds of thousands of years. Through our evolutionary history, we've always worked in teams. We have anthropological and archaeological evidence which tells us how team working was already highly developed 500,000 years ago in human species. This is the way we've always worked. It's making sure that we continue to nurture that way of working and build it back better for the future. And there are lots of good examples where this is happening across health and care systems with hugely positive outcomes for staff, for patients, and for organizational performance. And the third area is the third need is the need for a sense of competence or contribution, that the work I do makes a difference. You know, we've seen often in health and care services generally, but particularly during the pandemic, the sense of moral distress that people had from feeling that they weren't able to deliver the care that they felt they should be delivering. Talking this week to an A&E consultant telling me that the longest wait in her A&E department was 46 hours, and the damage that does to her soul. Seeing patients waiting that long, or seeing patients lined up on trolleys in the corridors and her having to walk by because there are just so many patients to try to see. And it corrodes people's well-being and their sense of competence. And the number one factor that we know that reduces people's sense of contribution or competence in health and care is chronic excessive workload. It's the number one factor in staff stress, the number one reason why staff intend to quit. And yet it's a bit like the pattern on the wallpaper we no longer see. We don't talk about it. Yet we know that chronic work overload has an impact on staff cardiovascular disease, addictions, alcoholism, cancer, diabetes, depression. So we must talk about chronic work overload in wherever that occurs. I think we need to make work overload a topic of conversation in our team meetings, in all appraisal meetings, in executive team meetings of organizations, so that we are ensuring that we're keeping a balance of people's work set load, so that we're not damaging their health and well-being. I do think there's a kind of pathology of overwork in our society generally that we must begin to address. And what was really inspiring for me in these two inquiries was seeing so many amazingly wonderful, inspiring examples of where one or more of these things are being addressed. And the links to the two reports are there at the bottom of the slide. And Paddy, I'm sure you'll circulate the slides to those attending afterwards. Thank you. I've mentioned, you know, the importance of compassionate leadership and inclusive leadership and effective leadership and collective leadership and working across boundaries, and the importance of team working. And I want to dwell a little on the importance of team working, not to go through all of these points, but just to make clear that if we are going to improve our team working, we must get these basic things right. We must have a clear vision of what our purpose is as a team. And when we have meetings together, they should be positive, engaging meetings, not people sitting around just thinking, when is this going to end? Or what a waste of time this is? Or, you know, I could be doing my emails now instead. It's people coming together and being really engaged. And we know that chronic interpersonal conflicts are a disaster for team working. So we must ensure that we create environments where there isn't chronic interpersonal conflict. Of course, we all fall out from time to time in our families, in our teams, but a healthy environment is one where those conflicts are managed quickly, speedily, and we move on and feel safer as a consequence. The other sorts of conflicts about what we should be doing and how we should be going about it are conflicts we should lean into in a courageous, transparent, mutually respectful, supportive way, because dealing with those sorts of conflicts both leads to innovation and increases our sense of safety and effectiveness in the way we work. And every team should have as one of its 4 or 5 objectives improving the effectiveness with which we work with other teams and organizations in service of the people that we provide support for. And the, I suppose, fourth substantive, I think, learning from the pandemic is how important it is, and I've alluded to this already, how important it is that we stop and take time out to reflect regularly, collectively, individually. What are we trying to achieve here? How are we going about it? What do we need to change? And I began, as I said, looking at teams in health and social care back in the 1980s. And pretty quickly, we saw so many teams under enormous pressure. And we began to ask the question in our research in the early 90s, what happens if teams stop and take time out on a regular basis? And the unequivocal conclusion from our work and other research teams around the world is that teams that stop and pause and reflect are much more innovative, much more productive, and much more effective. And, this can be medical teams dealing with major trauma in combat zones, introducing 2 patient rounds a day and a consultant round, much more innovative and effective. It's ward teams taking 15 minutes at the beginning of a shift and at the end of a shift to review, to reflect, to plan, to prepare. It's A&E units under enormous pressure taking a half an hour at the end of every shift to review, to learn. It's teams during the pandemic coming together in huddles repeatedly. A meta-analysis combining the data from 49 separate studies, published studies, showed that teams that do this on a regular basis are between 35 and 40% more productive. I mean, that's an astonishing figure. It's an amazing figure. And so there is something about we seem to get caught up in spinning hamster wheels, and when the going gets tough, we just spin them faster. It's not smart, it's not innovative, it's not effective, it's counterproductive. So this is just to summarize really what I've been saying today. So I'm not going to go through all of this. As Paddy very kindly said, during the pandemic, I had the space and time to bring together research, inspirational case examples, practical tools, in a book called Compassionate Leadership, Sustaining Wisdom, Humanity, and Presence in Health and Social Care. Thank you, Paddy. And with the support of Health Education Improvement Wales. So that's there, and I hope if you access it, you'll find it really useful, and you'll see many case examples that I haven't had time to talk about today. But I want to finish by saying the most important basis for all of this is having the courage, is each of us having the courage to be self-compassionate. I think that's almost a prescription for every human being on the planet. It's both about recovering from demanding work, and my colleague Sabine Sontag at the University of Mannheim has been researching this for over 20 years about the activities that enable recovery, those that give a sense of psychological detachment. I said I was talking to an A&E consultant this week, and she keeps bees in her spare time. But it could be watching a Netflix series, and of course, relaxation, meditation, doing things outside of work that give us a sense of real achievement. And proper work breaks are important, not only for recovery, but also for safe patient care in health services. And the extraordinarily powerful effect for recovery of spending time in nature. Blue environments are most effective, closely followed by green environments. I cycled past that particular reservoir pictured there today, very nourishing. and then some way down urban green environments, parks, and but even being outside at all is helpful under the sky. So it's also about self-compassion, is making sure we do what we need to do to recover, learning from the research on the ways to human well-being, and by far the most important is spending good quality time with the people we love and who love us. There is no question. I mean, it's been a consistent theme of what I've said today, this importance of belonging, being with those we love and who love us. And you know, sadly, I must reinforce that we have to get enough sleep. I mean, 98% of us need 7.5 to 8 hours sleep a night, and we can't cheat nature in terms of our well-being. And as I've said repeatedly, helping others is really powerful for our well-being. So it's about having, all of this is predicated on us having, each of us having the courage to be self-compassionate. And that means having the courage to be self-aware in the moment, to be aware of when I'm feeling hurt, irritable, angry, ashamed, inadequate, and indeed joyful and connected. And then having the courage to accept those feelings. You know, acceptance and commitment therapy is very much part of positive behavioral support, is having the courage to accept those feelings rather than push them away or deny them, or add a further layer by being cross with ourselves for experiencing those feelings. And then having the courage to inquire into them. Why am I feeling like that in this moment? Because I had that kind of slightly hurtful interaction with a colleague just now. And then having the courage, and this is a big step for people who work in caring roles, having the courage to turn a nurturing orientation to ourselves, as it were, to metaphorically, or indeed physically, hug ourselves, care for ourselves. Because after all, each of us is as deserving of love as every other human being. And when we practice this self-compassion as a way of being, then we connect more deeply with our own being, with ourselves, with the core values that give our lives meaning, like wisdom and courage and compassion. And when we connect more deeply with ourselves and openly with ourselves in that way, it enables us to connect more deeply and authentically with all of those we work with, provide support for, our colleagues, indeed all of those we interact with in our lives. So all of this begins with having the courage of self-compassion. Thank you. I don't hear you, Paddy. Yeah. Thank you.
Because I know other people will be doing the same at their end. Michael, I mean, if you're anything like me, I can't keep up with comments that are coming in as I'm presenting, but overwhelmingly positive. Wow, it's so much to look at there. From us, thank you so much. As I said, I've been lucky enough to be looking at some of this stuff for the last couple of years now, and it really has not only, I think, helped me personally, but I think definitely helped my practice, and in my own small way we've tried kind of sharing the stuff that you have, and I think in terms of questions, I mean, I have loads. There's going to be some coming in. I think I can see people giving huge applause and all those kind of things, but a lot of the comments coming in, people just amazed by some of the benefits of this. There's a couple of questions I've got really, Michael. I'll maybe get some of the rest of the guys started. And Tia and Hannah, I don't know if you can just man that for a second, so to speak, whilst we look at some of these. But I think, like you said, Michael, it can get confused, the kind of concept of compassionate. I don't know, people seem to confuse it with taking the easy route sometimes, and that's certainly not what's being suggested here. Is you're talking about courageousness actually at times, and I think one of the things that came up, particularly with your helping strand, was about supporting people to manage conflict. Now, I've got so many different questions, but I think the place for me to start is, I know there'll be people watching this, because I've been there myself when I'm working for other organisations, that thinking, I need the rest of my organisation to hear this. I need my organisation to start paying attention to this. Where do we start? How can I get my bosses and my line managers to pay attention to this? And yeah, and for example, even just taking time out, I know there'll be managers on here thinking, how do I resource that? How can I get my team together and resource it? So I've chucked a few questions at you there, Michael, but I suppose first one is, for people thinking this is fantastic, where do they start?
So I think the starting place is always our own behavior. And at its simplest, I would say, the starting place is practicing being present with others. Mm. No more, no less than that. And actually, that's a huge step in a way, is to kind of relax into being present with other people. So this is not some, this is not some new skill, I think, as I said, that you have to learn and practice, and we start beating ourselves up for, oh, I wasn't present in that communication, oh, there it goes again. It's actually just relaxing back into the moment. So you and I are having a conversation now, Paddy, and we can choose to be present with each other by kind of letting go of all of the flotsam and jetsam. And in our work interactions, we can choose to be truly present with each other, present in meetings, in a way that's not about straining to be present, but about relaxing into the moment, to be here and now. And that opens up, I think, all sorts of possibilities for understanding, for listening with fascination, for empathizing, and therefore for helping. So I think the starting place is enjoying, if you like, the process of learning to be more present in all our interactions with the person we interact with in the supermarket, to engage them in conversation. It increases their sense of belonging, increases our own sense of belonging. And there is a kind of positive feedback loop, if you like, in the sense that it's beneficial for us to be present. And it's we're more likely to connect and engage in a conversation. And so there's that sense of belonging. The second, I think, is, what I've tried to do, as you know, Paddy, over the years, working with people like your father, is sharing the evidence about the effects of creating more human work environments upon the outcomes that we seek. That there is there is that value chain. It's an irrevocable value chain, that when we work in teams and organizations in this way, the outcomes we seek are much, much better. Care quality, satisfaction of clients, even financial performance are much better. So it's about presenting the evidence again and again and again. And my work is also very much about trying to work, first of all, with the senior leadership team of organizations. So getting the message across to them, because what we found is, if we don't have them committed to this agenda, it's very hard to change the culture of the organization. So what we do is try to work with the boards and the senior leadership team, but then to make sure that these values pervade the organization's DNA. So we have compassion-based recruitment, compassion-based appraisal, for values-based appraisal, values-based induction, so that we're weaving all of this in to the way we work as an organization. So I think that there are these different levels of how we can bring about this change. But the most powerful, I think, that we all have within our control is how we behave as individuals. And well, maybe even that's the wrong wording, is that how we choose to be as people, as human beings. And it should be, I think, not another skill that we have to develop and demand of ourselves, but a way of relaxing into naturally who we are.
Yeah, no, it's amazing. I think that time similarly, when we've engaged with some more senior aspects, more senior levels of teams, some of the senior leadership teams, and they've asked questions to us, particularly around commissioning PBS training or consultancy. We're increasingly having conversations about, is that the right way to use your resources, your money? Can you create time within your teams to talk, to have those moments of reflection, to engage your team? I think one of the things I put in the chat, I remember one of the lines in one of the reports, forgive me, I can't remember. I think staff engagement was one of the biggest predictors of patient outcome. And it just was a big slap around the face for me. And again, I think concern that some people have, even organisations like ours, that's a consultancy, our work is not drying up by putting that message out there. In fact, it's increasing, trying to support teams to have more time to do that. We're getting more work, so like you say, increasing that profitability for some of these larger businesses and that are worried about the impact this is going to have. The evidence is quite the opposite, that this stuff will help. If that's your key performance indicator, this stuff is going to help you. This will pay off. And I think sometimes for some people in organizations, it's learning how to speak the language of your leadership team sometimes, isn't it?
So you're right. What we found in health services was that of all of the data that's collected in the National Health Service in England, the one measure that predicts trust performance way above all others is the level of staff engagement. And particularly in relation to staff engagement was the extent to which they were truly involved in decision-making. So it's creating a kind of more participative, collective culture. That's what really predicts outcomes. So for example, Northumbria NHS Trust is a really outstanding trust. It has been for some years. What drives their strategy and what has driven their strategy for many years is a focus on patient experience. And so they collect data day by day on patient experience. In the last few years, they've appointed a chief experience officer. Her name is Annie Laverty on the executive team, to gather experience not only of patients, but of staff as well. And that drives their strategy. And they found they introduced an anonymous Facebook page during the pandemic called COVID Voice. And they found that what staff were saying pretty quickly was, we're terrified because we don't have adequate PPE equipment. Mm-hmm. So they built, within 10 days, they built a factory and they hired local people as cutters and sewers. And within 6 months, they produced over 2.5 million gowns and other pieces of PPE equipment for use by their own staff, but also staff more widely in the NHS. Mm. And that's an example of the way that they have made staff engagement the core of their strategy as an organization. And they have levels of stress amongst their staff 50% lower than the NHS generally, very high levels of patient satisfaction, very high levels of care quality. They almost take responsibility and ownership of the challenges that face them. I always think, leaders' role is not necessarily to have the answers to problems. Leaders' roles are to bring the attention and the resources of the whole organization to bear on the most difficult problems we face. Northumbria, like the whole of the NHS, was facing the problem of lots of patients in beds who were medically fit to leave, but there was nowhere they could go in the community. So they've just bought care homes and domiciliary care premises so that they can create those care homes themselves in the absence of something being available. So, this is through the discussions they've had with staff, generating solutions to the most difficult problems we face.
Amazing. Michael, I think can we squeeze one more question in? Is that all right with you? Danny Davis has asked, do you have any tips for facilitating discussions on workload and well-being within perhaps a rigid outcomes-based service and leadership model?
So East London Foundation Trust, which is one of the most effective NHS trusts in the country. It's a large mental health and learning disability trust in a very challenged area of East London, regularly asks all its staff what work activities they would reduce or get rid of. And that's a rolling program, if you like. And they've eliminated lots of unnecessary bureaucracy, lots of unnecessary having to ask for managerial permission, lots of unnecessary travel to trust headquarters. They've eliminated 85% of clinical audit activities in the context of their quality improvement culture. So that's an example, I think, of what we need to do. We need to ask the staff what they will get rid of. And by the way, it's not the senior management who then decide what activities will be reduced. They have these conversations about reducing activities along with patients and service users and patient service user representatives. And then they come to decisions and people are empowered at local level to make those changes. So that's an example of where it's being done. But I think that it's also important to get across to people a recognition that typically what human beings do, we know from psychological research, is that when people are asked to improve a system like an appraisal system or a recruitment system or a Lego building, that 95% of times people add stuff to it. So we just keep adding all of this stuff in, when often the solution is to take things away. You know, the advent of electric cars is a lot of that is about reducing the things that drivers have to do. This bias towards adding things in is dysfunctional in organizations, and it costs an enormous amount and reduces productivity and effectiveness. So again, I would say there's something about dripping the evidence in to people as well. But I think that, you know, we should be making, as I said, workload a discussion in every appraisal meeting, every team meeting, every departmental meeting, every executive meeting, because it is so damaging in terms of turnover of staff well-being, and in terms of quality and effectiveness as well.
Michael, it's unusual to see such a commentary. Some of the feed coming in, because I've been doing my best, is words such as nourishing. So I hope that's kind of lovely feedback to you. This has clearly gone down really well. I know this is not why you do this, but there's been 4 people admitted to have purchased your book whilst we've been.
Well, with my mother, that makes 5. Thank you, Paddy, very much. Thank you. It's been a privilege and a pleasure for me. Thank you very much.
Real honor. Michael, thank you so much.
Thanks, everybody.
See ya.